I thought what I might do is try and start things off today and set the stage for really what has brought us here and why. On August 18th, President Biden announced a vaccine requirement for nursing homes, and I got some of his remarks. I did look at the news conference that he gave on that Wednesday night live, but I did also gather a couple of his quotes that I'll share with the group to get us started. He says, more than 130,000 residents in nursing homes have sadly, over the period of this virus, passed away. The study showed that a highly vaccinated nursing home staff is associated with at least 30% less COVID-19 cases among long-term care residents. With this announcement, I'm using the power of the federal government as a payer of healthcare costs to ensure we reduce those risks to our most vulnerable seniors. So he has one other quote that I highlighted here, and he says, if you visit, live, or work in a nursing home, you should not be at a high risk for contracting COVID from unvaccinated employees. So of all the quotes and all the comments that President Biden made Wednesday night, I thought for me, those are the ones that really succinctly explain his rationale for the requirement that he has issued. As far as our company's position on the vaccine has gone, really up until this announcement, we've taken the position that we respect everyone's right to choose to take or not take the COVID vaccine. We have, I think, made it clear that as a leadership group, as a company, and as a team, we feel like the vaccine is the best way to protect yourself against the virus and our residents. And we've taken the position that it's our goal and our role to educate all of our employees about the vaccine and to help them get the information they need to make their choice and to have access to the vaccine. And through that, those exercises and the communication that we've had and the doc talk that we hosted on this venue with all of our medical directors, we have achieved a significant degree of improvement. We've increased our percentage of vaccinated employees from 30% in March, when all of the initial COVID vaccine clinics were completed, to 54% was the most recent measure that we had. So we're at 54% today across the organization. And I would just offer that, sometimes in setting goals and in business especially, it's always good to improve. We want to improve from week to week. We want to get better at what we do, but sometimes that improvement isn't good enough. And I think that, the question is, how serious is the COVID threat? What is the climate of COVID infection? What's that positivity rate? What's that hospitalization rate? And what we've all seen is that from the time the vaccine came out, that threat was reduced significantly. And there was time to educate and to make careful choices and make sure that we have all the information before we move forward. And I think if we're all, watching the news and paying attention to the COVID positivity rates and the hospitalization rates and the availability of ICU beds, I think that there is a concern that the improvement isn't enough and the pace of improvement is enough. And that's how we get a vaccine requirement for nursing homes from the President of the United States on Wednesday, August 18th. So in order to move forward right now, just a few more comments. As a company, we continue to respectfully request that our employees take the vaccine for their own safety, as well as the safety of their family, our residents, our employees, and our employees' families. We don't have many details of the vaccine requirement at this time. We especially don't have an effective date. When someone comes out and says, you are absolutely required to do something, I think most of us would like to know immediately, well, how long do I have to comply with this requirement? And unfortunately, we don't know. So we are waiting for CMS, the Centers for Medicare and Medicaid Services, to issue a written rule. For those who follow CMS, they'll issue typically a draft of that rule. They'll invite comment, and then they'll issue what's called a final rule. So they've not done so yet. I think they were also, I don't want to say surprised, but I don't think that they had a head start on writing that rule before this announcement was made less than 2 weeks ago. We intend to work with every employee to help them apply for any medical or religious exemption that they may wish to apply for, help them to receive the vaccine, continue to make the vaccine available prior to the effective date of the requirement, or plan their exit from the skilled nursing industry. It's unfortunate. This is something we, had really tried to avoid is a strict requirement, but now that we're here, we all have some choices to make, and something that we want to be sure of is that as everyone makes their choice, there are no hard feelings between our company, our skilled nursing facilities, and our employees. If any employee ultimately decides they're not comfortable with taking the vaccine, it's important that they know that they'll be leaving in good standing with us. And if their decision changes, if their choice changes, and they choose to any time in the future get the vaccine, they'll be welcomed back if they choose to come back and work in this industry again. On that note, we have had several incentives and promotions, and we try to have fun with this vaccine process and in achieving this growth from 30 to 54% vaccination for our employees. There have been several incentives for those employees that make a choice to get the vaccine, and I just want to assure everyone that we intend to offer those same incentives to individuals that make that choice today. So I know one of the more popular promotions was a PTO day, for example. And so moving forward, when employees choose to get the vaccine, they'll be granted that free PTO day. And we'll be looking to just make sure that we continue to offer all of the incentives that were offered in prior promotions. Last comment I have before I turn things back over here to the group is, one of the questions we've gotten consistently is, who's required to participate in the vaccine requirement? And the answer is all Exceptional Living Centers employees and contracted staff will be asked to follow these policies and procedures. There have been some questions about, what if you're hired 2 weeks from now? What if you were hired 2 weeks ago? What if you're an employee now? What if you've been an employee for a long time? It's all Exceptional Living Centers and all of the facilities that we're affiliated with, all of the staff will be required to comply with the vaccine requirement. The exception really are the medical or religious exemptions that you can apply for through your business office. That's really the only exceptions that will be offered. So I think that about covers it. Angie, Mark, Carolyn, anything to add?
Yeah, absolutely. On behalf of the operations team with ELC, we want you to know you're not alone. I think that in each of our centers, we have EDs and DONs and HR directors and regional team members that have are available to you for questions, for individual one-on-one conversations. Sometimes in a group setting like this, it may be a little less likely that maybe you're willing to hit that Q&A button and ask your question, but we're here for you. I know that they've worked very, very hard to communicate guidelines and to really lead the charge internally in the building when we think about our EDs and our DONs and our HR directors, but no, we're here for you. Our goal is just really to cast a shield of protection over you and the peers that you work with and our residents and your families and the families that our residents have that visit. Mr. Watts did mention that we don't know the effective date of the vaccine mandate yet, but I will tell you, I encourage you, don't delay. Get the vaccine today. We're seeing a broad sweeping movement of COVID in our communities and unfortunately in the buildings. that we serve today, and our residents and staff are being affected to a point that, you know, we've lost two ELC staff members in the last 6 weeks, you know, from the effects of COVID, and, you know, having employees pass away is something that we had hoped that we never had to speak of, or to, you know, to deal with, and for you and your buildings to deal with. And so don't delay. We're here for you, and we appreciate all that you do.
Gonna have to say, well said, Angie, and I'd have to reiterate, you know, it's the importance of the vaccination and to save lives, not only our own, but the lives of others. And again, anyone with questions offline, you know, we're all here to support you and answer your questions. So in the event you need to talk to someone, just reach out. Don't hesitate. Let's get vaccinated.
I sent Tom a note yesterday talking about the rule coming out, and it really didn't say much, but it was from Twitter. So I followed CMS's Twitter, so now I'm getting propaganda from CMS, but I just got one and I thought was timely before this. It says, vaccination shows you care, and compassion and care is what this company is built on. So I urge everyone, as Angie said, to get vaccinated as quickly as possible. We'll be starting up the vaccine clinics, but CVS, Walgreens, Kroger, Meijer, they're all giving vaccinations. I know your local health department, your state health department can help you find if you want a Moderna, Pfizer, or J&J. They can help you do that. They can help you find that. And you know, one thing I didn't mention in the last two meetings we had, well, there's a lot of focus on this vaccination. Vaccinations have been around for a while. That's why we don't have polio anymore. If your kids go to school, they need to be vaccinated, or again, they have to have a medical or religious exemption. And really, as healthcare workers, it's been standard practice. We've been getting a flu vaccination for at least the past 10 years. I think it's been basically something we need to do. It's something that Carolyn and Angie brought up, that, hey, when are we getting our flu vaccines? We've kind of lost sight of that. So we've got more vaccinations that are going to be coming. The flu vaccination, pneumonia. So this is the big one. This is the one that's a point of interest now, but it's important that everybody get the vaccination. And as Tom said, if it's something you just can't get on board with, we can understand that. We respect your decision, and we want to exit as friends. And if you want to come back once things change or the vaccination becomes more accepting to you, we're willing to welcome you back with open arms. Thank you.
Great. Thank you all. I'll start with a couple of questions we've gotten so far. What is the process for applying for exemptions, and how long should we expect to hear a decision once we've turned those in?
So put simply, if you're interested in applying for the religious or medical exemption, I would direct you to your facility business office. They should have the information available to them that you'll need to gather and include with that application. There's not a form, you know, it's not a fill in the blank, check the box sort of application, but there's some basic information that will be required. I can't give a time frame for exactly how long it will take to consider those exemptions. Frankly, it's something that's a little bit new to us. You know, the concept of a medical or religious exemption from vaccines is not a new concept, but it's one that's, as you might imagine, hasn't been top of mind for some time. So the COVID vaccine has changed all of our lives. It's changed the way we process information here in our HR department, and it's something we'll do our best to respond to as quickly as we can, but just trying to be very transparent and honest with the group. I just don't know exactly how long that may take. Frankly, I I don't know how many we'll be receiving, but I'm expecting to see some volume of applications. So hate to overpromise there, but we'll do it as quickly as we can.
Thank you. The next question we've received is there going to be a written statement or policy about what aspects the company will cover if an employee gets a vaccine and has a reaction? I know we've gotten questions about workers' comp in the last few days. This may go along those same lines.
Yeah, that's a great point. And let me, before I answer that, and you may have said this already, Lauren Ashley, but we are compiling a list of frequently asked questions. This is the third town hall meeting that we've had in 3 days where we receive questions. And I know Lauren Ashley is tracking those questions and answers, and we'll make those available so that you can benefit from other questions you may not have heard or reference answers to questions that have been posed today. Yeah, absolutely. So workers' compensation is covers that we carry, and it's there for any work-related injury of any kind. So to the degree that someone gets COVID either at work without a vaccine before now, or because of a vaccine, I would absolutely encourage you to file a workers' compensation claim and expect that your, well, again, work-related injuries or illnesses would be covered. So just on the concept of a written statement, that's not something that we intend to do. I'm not a lawyer, but there is coverage through workers' compensation that I couldn't begin to outline in a simple written statement, but just want to assure everyone that that those benefits are available.
Thank you. Next question is about the booster. Are we required to get the booster? And I think what they're asking is that going to be part of this overall requirement that we have, someone gets 3 shots instead of the 2.
Yeah, good question. And so short answer is what we know is really limited to President Biden's comments. His news conference Wednesday, August 18th was a surprise to me, just as it probably was to everyone else. If you're curious, to read more of his remarks, I just did a simple Google Biden vaccine requirement for nursing homes the other day and looked at these articles that I was reading quotes from earlier today. But right now, the guidance we have from his announcement are pretty slim. It's unclear as to whether or not the booster shots will be required. The booster shots is somewhat of a new announcement as well. They're recommending booster shots for, I believe, both of the mRNA vaccines, the Pfizer and the Moderna, but not the Johnson & Johnson. It's recommended 8 months after your second dose. But really, until CMS issues that rule, the written rule, we just won't know really what sort of specifics will be outlined as far as what they're calling this vaccine requirement. So unfortunately, I really don't have a clear answer for you until that rule comes out.
Thank you. This is a question more about the vaccine in general versus the requirement, but someone's asking about the difference between a vaccinated person and an unvaccinated person if both can catch and transmit the virus. This may be a good question for Carolyn.
A vaccinated person, as we've seen, can contact the virus. However, the information in the studies out there show that they're less likely to be hospitalized. Their symptoms are lessened. And obviously a vaccinated person is the same. And I think the last thing I read was like a 2 to 5%. And if anybody else has heard anything different, let me know. Difference in a vaccinated person and an unvaccinated person of death. So that is pretty good percentages of what we're seeing now in our nursing homes and in our communities.
Yeah, I don't, the last number I saw was 98.5% of hospitalized people were unvaccinated during this current go around. And that is, I think as of yesterday, 97.5% of all ICU beds are being taken up. Now, those all aren't COVID, but it's worse on you if you're unvaccinated. The vaccination does give you some coverage, and I think it lessens the shedding of the virus.
One of the quotes I read to start the discussion here was, and I'll read it again, from President Biden. The studies showed that a highly vaccinated nursing home staff is associated with at least 30% less COVID-19 cases among long-term care residents. So as we seek understanding for, why we have this requirement, I think it's as simple as that. And that's why I would refer you to his comments. I think, this is a requirement that's been announced by the president, his administration. And I think that says it all right there. We've tried to, all of us understand, about the vaccine and about COVID and about what makes it, about how we can protect ourselves. But again, I would look to his comments for why we're doing this. The unfortunate thing right now is that, we've had this announcement. It is a requirement. And while we want to continue to make our medical directors and other experts available to all of our employees, we're preparing to follow a rule that's coming down from CMS that requires our employees to be vaccinated. And so the biggest difference between a vaccinated and an unvaccinated person going forward for us is one can work for us and one cannot. And it's just as simple as that.
Thank you. Carolyn, you want to add to that?
I was just going to say you would have a 5% better chance of survival only if you didn't, like I'm fully vaccinated. So some studies suggest that I have a 95% chance of not, having a significant negative outcome from COVID as a person that doesn't, which would be a 5% chance.
Thank you. Our next question is about going back to the workers' compensation question. Someone's asking if, I guess, the timeline to when you can apply for that. So if someone contracted COVID when their building had an outbreak earlier in this year, if they're still eligible to file workers' comp, that may be on a case-by-case basis. But Tom, can you address that?
Yeah, it may be a case-by-case, Lauren Ashley, but yeah, you should. You absolutely should. So, workers' compensation is there to provide benefits and protection for work-related injuries or illnesses. So if you contracted COVID during an outbreak previously at your facility, you should seek some assistance from your business office to submit a claim through workers' compensation. The business office will work with folks in the corporate office who will send that claim along to our workers' compensation carrier, the insurance company. And that's where they work through all the details of the claim and, judge it on its merit and make determinations about benefits. But again, the short answer is yes, absolutely.
That is all the questions we have right now. I'm going to do a last call for questions if anyone wants to give any closing remarks.
Yeah, I feel like I'm repeating myself at this time, but I'll say it one more time. I thought that I think our company's done a good job. And when I say our company, I mean every individual that's tuned in to this town hall. We've all done a good job of improving the vaccination percentage of our workforce over the past 5 months. I'm really proud of where we are. Satisfied might be the right word in terms of our improvement from 30% to 54%. I wish that I wish that we could continue down that course and cross the finish line in due time. I really feel strongly that this requirement is not something that anyone wants to do, but when you just focus on some of the quotes from President Biden, it's not hard to see the logical reasoning behind his decision to require vaccines in nursing homes. And unfortunately, it's putting all of us in a spot where we've got to make some decisions a little bit more quickly than we would like to. And I regret that for the employees that are having a tough time making those choices. and I regret having to be the person to bring this information to you. I wish we had more time. We're clearly improving. I think we're doing a good job. But ultimately, just the COVID climate dictates us to make some tough decisions and move more swiftly. And that's the decision that's been handed to us by the president. And that's the directive he's given to CMS. And just really appreciate everyone giving this some careful thought. And please let us know, let your leadership know what we can do to help provide any information you may need to make your choice.
When Lauren Ashley started the meeting, she said this was our third and final iteration of this. And while it is the final of the beginning, as more information is brought to us and known, we will continue to have these town halls to discuss it with everybody that we can, to make sure everybody has the most up-to-date information. And the final note, when COVID started, they said, don't touch your face. Watching Zoom, I see myself touching my face way too much. So I apologize for everybody else who's seeing that, but I do have sanitizer here.
Thanks for being vaccinated, Mark. We appreciate that.
All right, thank you guys so much. Thank you to our attendees. We appreciate you getting on with us. Thank you to our panelists. And that's all we have for today.
Looks like we've got one more that popped up.
Yeah,
in the
thank you,
Q&A.
Mark.
Yep.
What was the answer to the decision based on medical or religion exemptions? I think someone missed that part, Tom, about how exemptions are applied for.
Yeah, so I'll say it again, short and sweet is see your business office. They will help you to gather the necessary information and submit it to the corporate benefits team for approval. Those are to be submitted to benefits@exceptionallivingcenters.com. And just keep in mind, those business office staff, this is new to us, it's new to them. We've given them some initial information to help gather the information that's needed for that request. And they're continuing to get additional training on that. So please have a little patience as we all work together to try and get that documentation and move forward. See your business office is a short answer.
Thank you, everyone.
Thank
Okay.
you.
Thanks, team.